At some point, your patient might have antibiotics administered through their line. One common device that we use is the Eclipse device, or an elastomeric infusion device. The Eclipse brand looks like this, and when you are getting your supplies ready to administer Eclipse for your client, you'll usually need to remove it from the refrigerator about 30 minutes ahead of time. Make sure that you're checking the label on it. The tubing will be coiled and there will be a prescription label on here. You want to make sure that has all the right information for your client and the medication that they're receiving. You also want to make sure that you're checking expiration dates, because these typically are only valid for a few days. So once you're getting ready for this infusion, you'll gather all of your supplies. Make sure you know how long it takes for this to be administered so that you're ready when it's finished. This particular device says that it's filled with the 100 milliliters and it infuses at 100 milliliters per hour, so it would take about 1 hour for this to infuse. The nice thing about these devices is that they are not dependent on gravity. There's kind of a balloon inside of here, so it infuses on its own. It can be in the client's pocket, it can be laying on the bed next to them, or there are also little clips that attach to the end of these so they could clip it to their clothing. So when you're gathering your supplies to get this started, you'll have the Eclipse device, gloves, alcohol wipes, and a saline syringe. I just washed my hands, so I'm ready to get started. We always want to use what's called the SASH technique. SASH stands for saline, antibiotic or administration, so in this case we're going to use the Eclipse, followed by saline and heparin. And with each reconnection, we're always going to scrub with an alcohol wipe. So I'm going to put my gloves on. With the Eclipse devices, you do need to prime the tubing. This particular sample that we have has already been primed, but I would open the cap and I would remove the end cap here. Maybe. And then watch until the solution reaches the end of the tubing. And again, this particular one has already been primed just for our example, but once I get it primed, then I'll put the cap back on, and then this is ready. I'll get an alcohol wipe, and I'll scrub the cap. Whenever you open a new saline syringe, you have to relieve the pressure or kind of break the seal. It's best to pull back a little bit to do that, and then push up to remove the air. I'm going to connect this to the cap. Open the clamp, and then I'm going to check for a blood return. And then I'm going to push pause my saline flush. You push and pause to create turbulence in the line so that the inside of the line stays as clear as possible. I'm going to close the clamp, remove my syringe. I'm going to get another alcohol wipe. I'm going to scrub the cap. And then I'm ready to start my infusion. So I'm going to remove that cap from the end of the Eclipse line, connect it to the IV cap, and then open the clamps. And the infusion can begin. I'm going to throw away the supplies that I've used, wash my hands, and I'm going to document the start time for this procedure. So it's been 1 hour and my infusion is complete. I have washed my hands. This is what it looks like when it's complete. It kind of looks like an apple core inside of there. The balloon is no longer full. So I know that it's all done. I've washed my hands and I've got my supplies ready. I need gloves, my alcohol wipes, a saline syringe, and my client has an order for heparin as well. So again, with the SASH technique, we're going with saline administration or antibiotic, saline, heparin. So I did my first saline, I administered my antibiotic, and now I'm ready to follow with a saline and a heparin flush. close the clamp on my Eclipse tubing and on my central line. I'm going to remove the tubing. I'm going to scrub the cap. I'm going to flush the line with saline. Again, using that push-pause technique. We're going to scrub the line again. And then I'm going to flush with heparin. Again, not pushing the syringe all the way, the plunger all the way to the end of the barrel to leave positive pressure in the line. Now I'm finished. I'm going to clean up my work area, wash my hands, and document the administration of the medication.